Everyday English conversation practice. At the hospital.
Checking in at the reception desk.
Good morning. Welcome to City Hospital. How can I help you today?
Hi, I have an appointment with Dr. Wilson at 10:03 a.m.
All right. May I have your full name and date of birth, please?
Sure, my name is Anna. I was born on May 2nd, 1992.
Thank you, Anna. Let me check the system. Yes, I see your appointment. Please have a seat in the waiting area. The nurse will call your name shortly.
Thank you. This is my first time here. Where can I find the restroom?
The restrooms are just down the hall, to your left.
Great. And do I need to pay anything now?
You'll pay after your consultation. If there are any tests or prescriptions, we'll include that in the final bill.
Got it. Will I get a paper receipt or an email?
You'll receive both. Do you prefer email only?
Yes, email is fine.
All right, I've updated your preference. The nurse should be with you soon.
Thanks for your help.
You're welcome. If you have any other questions, feel free to ask.
Describing symptoms to a doctor.
Hello, Anna. I'm Dr. Wilson. What brings you in today?
Hi, doctor. I've had a sore throat and a mild fever for the last 3 days.
I see. Have you had any cough, chills, or difficulty breathing?
I've had a light cough and feel a bit tired, but no breathing problems.
Have you taken any medication so far?
Just some paracetamol for the fever. It helps a little.
Any allergies to medications that I should know about?
No, I don't have any known allergies.
All right, I'll take your temperature and check your throat. Please open your mouth and say, ah.
Ah.
Your throat is quite red, and you have some swelling. I'll also listen to your chest. Take a deep breath in and out. Good.
Is it serious?
Nothing too serious. It looks like a viral infection. I'll prescribe some medicine to reduce your symptoms. Rest and drink plenty of fluids.
Okay, will I need antibiotics?
No, since it's viral, antibiotics won't help. But if it doesn't improve, in a few days, come back.
All right, thank you, doctor.
You're welcome. Take care and get some rest.
Visiting a family member in the hospital. Hi, I'm here to visit my brother. His name is James Tran. He was admitted last night.
Let me check. Yes, he's in room 207, on the second floor.
Can I go up now? Are visitors allowed?
Yes, visitors are allowed from 10 a.m. to 8 p.m. It's currently 2 p.m., so you're fine.
Great. Do I need a visitor badge or anything?
Yes, please take this badge. And wear it while you're in the hospital. Also, please sanitize your hands before entering the ward.
Of course. How is he doing? Do you know?
I'm not allowed to give medical details, but his nurse can update you when you get to the room.
Got it. How do I get to room 207?
Take the elevator to the second floor, turn left and follow the signs to the west wing.
Thank you. Can I bring him food or drinks?
It's best to ask the nurse first. Some patients have dietary restrictions.
Okay. I'll check with them. Thank you for your help.
You're welcome. Enjoy your visit and let us know if you need anything else.
Will do. Thanks again.
Nurse checking on a patient after surgery. Good afternoon, Mr. Lee. How are you feeling after the surgery?
A bit sore, to be honest, especially around my lower abdomen, but I think it's manageable.
That's normal. You had an appendectomy and some discomfort is expected. On a scale from 1 to 10, how bad is the pain?
Maybe a 4. It gets worse when I move or sit up.
All right, I'll make a note of that. You're scheduled to receive another dose of pain medication in an hour, but let me know if it becomes too uncomfortable.
Thank you. Can I drink water or eat anything?
You can sip small amounts of water now. If everything goes well, the doctor will allow soft food by this evening.
Good to know. How long will I need to stay in the hospital?
If there are no complications, you'll likely be discharged tomorrow morning.
That's great. Can I use my phone or laptop while I'm here?
Of course, just try to rest as much as you can.
And one more thing. When can I get up and walk a bit?
We usually encourage patients to take short walks after 24 hours. I can assist you later if you'd like.
That would be helpful. Thanks so much for checking on me.
You're very welcome, Mr. Lee. Press the call button if you need anything before I return.
Getting test results from a doctor.
Hello, Mrs. Parker. Thanks for waiting. I have your blood test results here.
Hi, doctor. I've been a bit nervous about them.
That's understandable, but overall, your results look good. Your blood sugar and cholesterol levels are within the normal range.
That's a relief. I've been trying to eat better and walk every day.
It shows. However, your vitamin D is slightly low, and your iron level is just below normal.
Oh, I've been feeling a bit tired lately. Could that be the reason?
Yes, low iron can definitely cause fatigue. I'll recommend an over-the-counter iron supplement and a vitamin D tablet.
Do I need a prescription for those?
No, you can buy them at any pharmacy. I'll write down the dosage for you.
Should I change anything in my diet?
Try eating more iron-rich foods like spinach, beans, and red meat. Also, get some sunlight each day to help with vitamin D.
Got it. How long should I take the supplements?
Let's try for 1 month, then repeat the blood test. We'll see if there's improvement.
Sounds like a plan. Thank you for explaining everything clearly.
Of course, if you feel dizzy or more tired than usual, give us a call.
I will. Thanks again, doctor.
You're welcome. Take care.
Filling a prescription at the hospital pharmacy. Hi there, I just saw Dr. Wilson, and he gave me a prescription. Can I get it filled here?
Yes, you can. May I see the prescription, please?
Sure, here you go.
Thanks. Let me check if we have this medication in stock. Yes, we do. It will take about 10 minutes to prepare.
That's fine, I'll wait here.
This is a nasal spray and a box of tablets, correct?
Yes, he said, I need to use the spray twice a day and take the tablets after meals.
That's right. The tablets should be taken with food to avoid stomach upset. I'll include instructions in the bag.
Great. How much will it cost?
With your insurance, it comes to $12 in total.
That's not bad. Can I pay by card?
Absolutely. Please tap your card here.
Done.
Thank you. Here's your medicine. And these are the usage directions. If you have any side effects like dizziness or stomach pain, stop taking the tablets and call your doctor.
Will do. Do I need to refrigerate the nasal spray?
No, just store it at room temperature and keep the cap on tightly.
Got it. Thanks for your help.
You're welcome. Take care and feel better soon.
Emergency room visit after an accident. Hello, sir. I'm Nurse Chloe. Can you tell me what happened?
I was riding my bike when a car pulled out suddenly. I swerved and fell. My arm hit the pavement hard.
I see. Let's get you into this wheelchair, so we can take you for x-rays. Are you in a lot of pain right now?
Yes, my left wrist hurts badly, and it's starting to swell.
We'll take care of that. On a scale from 1 to 10, how would you rate your pain?
Probably a 7. It hurts more when I move it.
Understood. We'll give you something for the pain after the doctor examines it. Do you feel dizzy or nauseous?
No dizziness, but I do feel a bit shaken.
That's completely normal after an accident. Did you hit your head at all?
No, I was wearing a helmet and didn't hit my head.
That's good. Were there any other injuries? Scrapes, cuts, or bruising?
Just some scrapes on my leg. They're bleeding a little.
We'll clean and cover them after the x-ray. What's your name and date of birth?
Jason Lin, February 14th, 1988.
Thanks. Have you been treated here before?
No, this is my first time.
Okay, we'll get you registered and into the system. Just relax and try not to move your wrist. The technician will come get you shortly.
Thank you for being so kind.
Of course, Jason. You're in good hands.
Following up after a hospital stay.
Good morning, Mr. Davis. How are you feeling since your discharge last week?
Much better, thank you. I've been resting and taking the medication as prescribed. The chest pain has mostly gone away.
That's great to hear. You were admitted for mild pneumonia, so recovery usually takes 1 to 2 weeks. Are you still coughing?
Only a little, and mostly in the mornings. It's much better than before.
That's a good sign. Any fever or shortness of breath?
No fever. Breathing is normal now, but I still feel a bit tired after walking for too long.
That's to be expected. Your lungs are still healing. I'll listen to your chest. Please take a deep breath in and out. Again. Good.
Is everything sounding normal?
Much improved. There's still slight congestion, but no sign of infection. You're healing well.
Should I continue the antibiotics?
You should finish the full course. Only 3 more days left, right?
Yes, 3 days.
Excellent. I'm also going to recommend light walking daily and staying hydrated. Avoid any intense physical activity for another week.
Understood. Do I need another x-ray?
Not unless symptoms return. We'll schedule a follow-up in 2 weeks, just to be safe.
Great. I really appreciate how thorough your team has been.
Thank you for saying that. We always aim to support our patients fully. Any other concerns?
No, just hoping to get back to work soon.
You're on the right track. Let's get you there slowly and safely.
Sounds good. Thank you again, Doctor.
Take care, Mr. Davis. We'll see you soon.
Discussing surgery options with a specialist.
Good afternoon, Miss Ramos. Thanks for coming in. I reviewed your test results and MRI scans. Let's go over them together.
Thank you, doctor. I've been a bit anxious about what you might find.
I understand. Based on the images and your symptoms, it looks like you have a herniated disc in your lower back. That's what's causing the pain and numbness in your leg.
That explains a lot. It's been very difficult to move lately.
You've tried physical therapy and pain management already, right?
Yes, for almost 2 months. But the pain always returns.
Then it may be time to consider a surgical option. It's a minimally invasive procedure called a microdiscectomy.
What's involved in that? Is it a major surgery?
Not at all. It's done through a small incision, and we remove the part of the disc that's pressing on the nerve. The procedure usually takes about an hour, and patients go home the same day.
That sounds better than I expected. What's the recovery like?
Most people return to normal activity in 4 to 6 weeks with light movement and physiotherapy starting within a few days.
Are there risks I should know about?
As with any surgery, there are risks like infection, bleeding, or nerve damage, but serious complications are rare, less than 5%.
I see. Is it something I need to decide quickly?
Not necessarily, but I recommend making a decision within the next week so we can schedule it.
Okay. Can I take a few days to think and talk to my family?
Absolutely. Take your time. Here's a brochure with more details.
Thank you for explaining everything so clearly.
You're very welcome. I'm here if you have more questions later.
Talking to a pediatric nurse about a sick child. Good morning. I'm Nurse Lily. You must be Mrs. Carter.
Yes, thank you. This is my son, Max. He's 5. He's been having a high fever since yesterday, and he started coughing a lot last night.
I'm sorry to hear that. Let's get him checked right away. Has he had any vomiting, diarrhea, or difficulty breathing?
no vomiting or diarrhea, but his breathing sounds a bit wheezy sometimes, especially when he sleeps.
I'll take his temperature first,
It's 38.9 degrees Celsius. That's a little high.
but not dangerous.
He's been feeling very tired too, not his usual energetic self.
That's normal with a fever. Has he been eating or drinking anything today?
Just a little juice and some soup. He said he wasn't very hungry.
I understand. Dehydration is something we'll want to watch out for. I'll let the doctor know, and he'll come by to examine Max soon.
Will they need to do any tests?
Probably a throat swab or maybe a chest x-ray. If the cough sounds deep, we'll keep you informed every step of the way.
Thank you. I'm just a bit worried. It's the first time he's been this sick.
It's okay to be concerned. You're doing everything right. Max is in good hands. I'll check on him again soon.
Thanks so much, Nurse Lily.
Of course. Let us know if he gets more uncomfortable, or if you have questions. Asking about hospital admission for an elderly parent. Hello, I'm here to ask about admitting my father. He's been very weak and dizzy for the past 2 days, and his doctor recommended observation.
I see. Has he already been evaluated by a physician today?
Yes, his primary doctor sent us with a referral letter and some test results.
May I see the documents, please?
Here they are. He's also in the car right now. We weren't sure if we could bring him in directly.
Thank you. I'll notify the admissions nurse right away. We'll help you bring him in through the side entrance with a wheelchair.
That's very helpful. Do you know how long he might need to stay?
That depends on what the doctors find during his evaluation, but usually, observation stays are between 1 to 3 nights.
He's been fainting and losing his balance a lot. We're really concerned it might be something serious.
I completely understand. The team here will run further tests, monitor him closely, and make sure he's safe.
Thank you. Will someone be in touch with me regularly about his condition?
Yes, the doctor will speak with you after the first assessment, and the nurses will provide updates during visiting hours.
What about meals and medications? Should I bring anything from home?
No need. We'll provide all his meals, and the pharmacy will handle any medications he needs.
All right, I'm glad he'll be cared for here.
He's in good hands. We'll come get him now.
Thank you so much. Discharge process and follow-up care. Good afternoon, Mr. Evans. Good news. The doctor has approved your discharge.
That's great to hear. I've been looking forward to going home.
I bet. First, let me go over a few instructions with you. You had minor surgery, so we want to make sure the healing goes smoothly.
Of course. What do I need to do at home?
You'll need to change your bandage once a day and keep the area dry for at least 3 days. After that, you can shower, but no soaking in tubs or swimming for 2 weeks.
Got it. Do I need to come back to the hospital?
Yes, your follow-up appointment is already
Scheduled for next Wednesday at 10 a.m.
That's when the doctor will check your stitches.
Should I bring anything with me to that appointment?
Just your ID and hospital card. The clinic has all your records.
What about medication?
You'll receive a small bag from the pharmacy before you leave. It includes antibiotics and mild painkillers. I'll explain how and when to take them.
Okay, thanks. I've been feeling a bit tired. Is that normal?
Very normal. Your body is healing. Just rest, eat well, and avoid any heavy lifting.
Can I go back to work next week?
You can ask your doctor at the follow-up, but in most cases, a week of rest is recommended.
All right. Thank you for taking such good care of me.
You're very welcome. Let me get your papers and call for a wheelchair to help you out. Talking to a hospital social worker.
Hello, Miss Taylor. I'm Sarah, one of the hospital social workers. I understand your mother was just moved to the recovery ward?
Yes, She had surgery yesterday. The doctors say she's doing well, but I'm concerned about what happens after she's discharged.
That's exactly what I'm here to help with. Does your mother live alone?
Yes, she does. She's 78 and very independent, but she'll definitely need help at home for the first few weeks.
We can set up short-term home care services for her. A nurse can visit daily to assist with medication, bathing, and light tasks.
That sounds helpful. How do we arrange that?
I'll start the paperwork today. Her doctor will fill out a medical needs form, and then we'll coordinate with a local care provider.
Is that service covered by insurance?
Usually, yes. At least part of it. I'll verify her coverage and explain any out-of-pocket costs.
Thank you. She also takes several medications. Will someone help her manage them?
The visiting nurse can assist with that, and I can give you a medication chart to hang at home.
That would be great. I just want to make sure she's safe.
You're doing the right thing. We'll also schedule a follow-up with her primary care doctor.
I feel better already just talking to you.
I'm glad you're not alone. We're here to support your family through the recovery process.
Thank you, Sarah. I really appreciate this.
You're very welcome.
International patient asking for translation services. Excuse me, I'm not very confident with English. Do you have someone who speaks Spanish?
Yes, of course. We have an interpreter on staff. Would you like me to call them now?
Yes, please. I have an appointment, but I don't understand everything the doctor says.
No problem. What's your name?
My name is Carolina Diaz. My appointment is with Dr. Martin.
Thank you. Please wait a moment. Okay. Our Spanish interpreter is on the way. You'll meet them before you see the doctor.
Thank you so much. It's hard when I understand some words, but not enough.
You're not alone. Many of our patients speak other languages. That's why we offer support. Hello, I'm Sophia. I'll be your Spanish interpreter today. I'll go into the room with you and help you communicate with the doctor.
Thank you, Sophia. That makes me feel much more comfortable.
It's my pleasure. I'll translate everything, and you can ask any questions. You're all set now, Carolina. The nurse will call you shortly.
Thank you. This hospital is very helpful.
We're glad to hear that. Let us know if you ever need help with forms, tests, or billing. We can assist in Spanish too.
I will. I really appreciate it.
I'll be right by your side. You're in good hands.
Gracias a todos.
De nada. Buena suerte.
Patient experiencing anxiety during hospital stay. Good evening, Mr. Ahmed. I noticed you haven't touched your dinner. Is everything all right?
Honestly, I've been feeling very anxious. I can't sleep, and I keep worrying about my condition.
That's completely understandable. Being in the hospital can be stressful, especially when you're waiting for test results.
I know, but my heart keeps racing, and I feel like something's wrong, even though the doctor said I'm stable.
Anxiety can cause physical symptoms that feel very real, like rapid heartbeat or tightness in the chest. Let's try some deep breathing for a moment, okay?
All right.
Inhale slowly, hold, now exhale. Again, good. Are you feeling a little better?
A bit. Thank you for listening.
You're not alone. Many patients feel this way. Would you like me to let your doctor know? He can prescribe something to help you relax.
Maybe. I don't want to depend on medication, though.
That's okay. We also have a counselor on staff. Would you be open to speaking with someone trained in emotional support?
Yes, I think that might help.
I'll arrange a visit for tomorrow morning. Meanwhile, try to rest. Would you like me to dim the lights and bring some warm tea?
That would be nice, thank you.
You're in good hands, Mr. Ahmed. If you feel overwhelmed again, press the call button anytime.
I will. I'm really grateful for your kindness.
That's what we're here for. Let me get that tea for you.